Dr. Fahmi Farah, a cardiologist, joining our programming live this morning. Thank you so much for spending some time with us. There are still so many questions surrounding what exactly prompted this cardiac arrest.
When I saw what happened on the field that night. He's so young, only 24 years old. So heart attack is less likely in someone young and fit. Some of the things you may have heard on the news lately, commotio cordis is one of them, which is a
Mhm.
big blow to the chest that can cause abrupt stopping of the heart and can cause somebody to collapse and have a cardiac arrest. But there's something else. It's called hypertrophic cardiomyopathy. What happened was actually a pretty classic presentation we typically see in young athletes sometimes. What this condition is a genetic thing, if that's what it was. People are born with it. They have increased thickness of the heart muscle, so heart is essentially enlarged. And when they get into situations like strenuous activities such as football, they can have arrhythmia like ventricular tachycardia and can collapse and have a cardiac arrest. So some of these things could be very common cause of what may have happened that day. One of the other things, I know that he did get a blow to his chest, and there's something called cardiac tamponade. So our heart sits in a sac. It's called the pericardium, and in a normal heart, there's not any space between that heart and the pericardium. But when there's a blow to the chest, such as what happened that night, or in a motor vehicle accident, sometimes our we can have blood building up between that space, and if the volume of blood gets large enough, it can cause the heart to stop and cause a cardiac arrest. So a number of things could have been the cause. We'll have to wait and see what the doctors say.
Definitely we'll have to wait and see. Now, another topic of concern is exactly how long he remained really unresponsive on the field. It took paramedics, EMTs 16 minutes to get a heartbeat. How could this possibly affect his recovery?
It is, to give you some statistics, out of hospital cardiac arrest in general, they have very poor prognosis. Between 70 to 90% of out of hospital cardiac arrest patients don't even make it to the hospital. The fact that they were able to get a pulse back is a good thing. However, as you said, the fact that his resuscitation time was greater than 10 minutes, uh, it's uh, it's not a good thing.
Mhm.
But the fact that they were able to get to him so quickly and the CPR was started in a rather quick manner within seconds of the collapse happening, that is in his favor. He did get a pulse back. He's in critical condition, but we hope that he makes it out of it. One of the other concerns we have is not just survival, whether he'll make it out of it, but the prognosis, the long-term prognosis, which is what kind of complications can come out of it. One of the major concerns we have when we have resuscitation time, long resuscitation time like that, is brain injury. When we have cardiac arrest, blood supply is of course cut off, and so the oxygen to the brain gets cut off, and our brain is very sensitive to that. So one of our key concerns here is his neurological function, how much of it he will retain. I hope that he does recover and that there are no neurological deficits, but only time will tell.
Absolutely. Only time will tell. Now, you mentioned earlier the fact that he is 24 years old, an athlete at the peak of his career. Do you think that this would possibly aid him in the career? And only time will tell, but talk to us about the factors that his current health condition could have on him making a positive recovery.
I think it is possible. I'm very optimistic. Being a cardiologist, I have myself resuscitated several patients, in fact, out of the hospital patients as well. And many of them have come to complete recovery,
Mm.
and they're living a completely normal life. Now, that being said, they're not athletes. So, being a football player, it's high impact, cardiac workup. So, um, I will have to see what time will tell us what kind of recovery he has. It may take him quite some time before he can get back to the field. Right now, I think our concern primarily is his recovery in the immediate setting.
Absolutely. Well, Dr. Fahmi Farah, thank you so much for joining us and offering context and analysis. I'm sure the world will continue to offer prayers and support, again, as you just said, hoping for a positive recovery. So thank you.
Thank you for having me.